Having worked in the Medicare space with Medicare beneficiaries since 2010, I would highly recommend all beneficiaries choose a Medigap or Medicare Supplement plan for their rich, comprehensive benefits when compared to Medicare Advantage. However, I do understand that that's not always an easy decision based on the cost of a Medicare Supplement premium compared to Medicare Advantage. Hi, my name is Mark Prip. I'm a licensed insurance broker and have been for 14 years. I'd like to show you what I have witnessed firsthand in the last 14 years in the Medicare world. So I'm going to provide you proof and evidence of what my office has experienced dealing with and working with thousands of Medicare beneficiaries over the last 14 years. So I created a slide of basically what I think are 7 of the most important moving parts of a Medicare Advantage plan that affect every single beneficiary some way, somehow. Full disclaimer, I have both Medicare Supplement and Medicare Advantage clients. So I've got 7 things. Let's jump right in. Number 1 is a hot button topic right now. Prior authorizations equal denied care. So I have this screenshot and I'm going to list all of these sources below for you to click on and view if you want, or you can just take my word for what I'm showing. But again, I'll provide resource links for you to view everything that I'm showing you. So the very first thing that I'm looking at here is from the Kaiser Family Foundation. Very, very reliable source. They do very in-depth studies on the Medicare market and provide a lot of supporting evidence as to the reports that they come up with. The very first thing I've highlighted here is over 2 million prior authorization requests were fully or partially denied by Medicare Advantage insurers, which is basically a Medicare Advantage insurance company. Okay, just 11% of prior authorization denials were appealed. Okay, so what that means is that more than 35 million prior authorization requests were submitted and over 2 million were denied, and just 11% of denials were appealed. So the ones that were denied, only 11% appealed them, fought against. Okay, so on paper that looks good. Hey, 35 million went through, 33 million were approved, and then 2 million were rejected. Okay, here's the problem with that, is that when a prior authorization request is required, that equals delayed care and time delays. Okay, let me explain why. Something happens to you, you go in the hospital, they say, okay, we figured out what's wrong, let's go ahead and do this procedure. Hit the brakes, you got a prior authorization, okay? So now you're sitting in a hospital bed or wherever you may be, waiting for that prior authorization process to go through. So even if it goes through and is approved, it means delayed care at some level. I'm going to skip to the next one, and this is again from the Kaiser Family Foundation. Prior authorization requests are more common among certain Medicare Advantage firms or companies. So you can see for yourself the table of where most of them come from. Now again, I'm not going to sit here and paint doom and gloom, because most prior authorizations are approved. It's the waiting and the fact that they're there as a gatekeeper that is going to cause time delays for you. This is a call that came into our office after hours, so we have an answering service. If you call us and you're looking for a Medicare plan or help with Medicare, there's an after-hours service. So this is a message that came through this morning. I've blocked out confidential information from the caller. The caller stated that her mother has Blue Shield, Medicare, and was denied therapy after a stroke and needs to know what is covered under the policy to get a nurse to help her mother. Please call back. Okay? So that's just one tiny example. It doesn't say what Medicare plan she has, but I'm probably 95% certain it's Medicare Advantage because Medicare Supplement plans do not have or require prior authorizations. Number 2 on the list is that many Medicare Advantage companies offer their members freebie benefits that are very alluring. If you have Medicare and Medicaid, you can get up to $1,800 a year for eligible groceries, rent, utilities, and more. Now, don't get me wrong, these free grocery benefits can be beneficial for many low-income beneficiaries. However, I strongly advise do not select a plan just because the plan offers these free ancillary benefits. We're trying to get people to enroll in a health insurance plan that's geared towards initially catastrophic coverage is why health insurance was developed to prevent you from going bankrupt. Now people are enrolling in these plans having no idea about prior authorizations, having no idea how Medicare Advantage plans work. They're falling for this $1,800 a year grocery benefit that Humana has. Same with here's Aetna. Get a monthly allowance on a prepaid card to pay for healthy food. At least Aetna's trying to encourage you to take care of your health in the process. But here's my suggestion to you. These benefits will be the first ones that get cut when the plans change every year, because that's how Medicare Advantage plans work. Every year, they receive notice of how much the government is going to reimburse them. Then they decide what benefits they can offer or what benefits they need to take away. So these free things will most definitely be the first things that go. I've been in annual insurance company training meetings for 14 years. So I've seen 14 years of companies saying, this year we have a grocery allowance. The following year, well, we did away with the grocery allowance. Now we'll give you a free ride to the doctor. The next year, well, we got rid of the free doctor rides. Now we're going to give you discounts on dental. So these low-hanging fruit perks, I cannot emphasize you enough. Do not enroll in a plan because of this. This is a perk. This should not be the core foundation of your medical care. It's a free benefit. It's a perk at the end. So my third point would be the government reimbursement roller coaster ride. And what does that mean? That means that every 12 months during the annual election period or open enrollment period from October 1st through December 7th, technically it's October 15th through December 7th, but that first 2 weeks in October you can shop plans, you just can't enroll. So what that means is that every year in that window, Medicare or the government decides how much they're going to reimburse companies. So that number can go up and they pay insurance companies a lot more, and then you see things like free groceries come into the picture, but then that amount can go down the following year where you see the free groceries removed. So that's my greatest frustration with Medicare Advantage plans is they are filled with moving parts that no agents are talking about. The advertisements are not talking about it. Everything is about enroll, enroll, enroll for a free plan with these silly free benefits. No one is talking about the hard reality of elderly population getting on these plans for medical care and then being denied or kicked off or their network changes. So the government reimbursement roller coaster is very real. It happens every year. Sometimes nothing changes, which is great. Other times your premium may go up a little bit. Other times your copays could go up. Other times you'll see a prescription no longer covered or a prescription moved in a higher tier. That's all about money behind the scenes, okay? Let me go to number 4 here. Number 4 is frequent provider disputes. Back in 2012, we witnessed here in Florida, United Healthcare and the Baycare system got into a claims dispute, and they were sending letters to over 400,000 people saying, we're not going to be in network with United Healthcare anymore. They are not paying us what I owe. United Healthcare saying, you're not paying us enough. So it becomes this tug of war in reimbursement money, and you as the member are sitting on the sidelines praying that the scheduled care you have or all your doctors and medical care that you see in network will still be in network. We moved 750 people in about a 3-week time from United Healthcare to a Blue Cross plan, which was still in network with United Healthcare. So that was the most chaotic year we'd ever seen. The phone rang 24 hours a day with people needing to get off the United Healthcare plan onto a plan that was still in the Baycare network. So here I'm going to jump forward to 2022. This is from Mayo Clinic. Mayo Clinic has never been fond of Medicare Advantage plans, but during the 2022 open enrollment period, they sent reminder letters out to their members in Florida and Arizona to suggest they enroll in original Medicare with a supplement. So now I'm going to jump to the next one. This is in January of 24. This is a Kentucky hospital. Baptist Health ends contracts with 2 more Medicare Advantage carriers. Those 2 carriers were Humana and United Healthcare. And probably the biggest news towards the end of 2024 was Scripps Medical Group in San Diego, California, abruptly decided to stop taking all Medicare Advantage plans in all medical facilities. I use this example to just encourage you to not take my word for it. I went to Google and I just typed in cancels Medicare Advantage plans and clicked the news tab, and here's what you're going to get. You're going to get all of these that have made headlines throughout the country. So Silver Scripps, 2 Scripps health groups are dropping Advantage in California, not Silver Scripps. It was called Scripps Health, I believe. Big thing. So take some time and do that and see what you come up with. Number 5 on my list is high out-of-pocket costs. What does that mean to you? That means that no one talks about that a Medicare Advantage plan has an out-of-pocket limit. That means that these plans are sold on the fact that they're free or low premium, or they have grocery benefits. What they don't tell you about is you have copays or 20% for a lot of services. So if you have a catastrophic year, and let's say you have $200,000 in medical bills, this says that in 2024, the maximum out-of-pocket for Medicare Advantage plans can be as high as $8,850 that you're responsible for. And you get there by paying your copays or percentages on the Advantage plan, okay? On a Medigap plan, I took Medigap Plan G, the only out-of-pocket expense you have is your Medicare Part B deductible, okay? This is pulling the 2023 Part B deductible. It's a little bit more now, but not much at all, okay? So that's your most out-of-pocket. Well, you may argue and say, well, yeah, Medicare Plan G is better coverage, but it's more expensive per month. It is. It's going to cost you a monthly premium. But everything I've talked to up until this point will not be a part of a Medicare Plan G benefit. There are no prior authorizations. There are no provider disputes. There are no government reimbursement rates. The only thing that we ever talk to our Medicare supplement clients about in the ongoing reviews are rate changes. Because look, the reality is that all insurance premiums are going to go up. Home, auto, car, boat, condo, whatever it may be, health insurance, life insurance. There's no way around that. The difference is that with a Medigap plan, you're going to have network freedom, go anywhere original Medicare is taken. You're not going to deal with the government reimbursement. You're not going to deal with the provider disputes. You can travel, you can go anywhere you want in the country that takes original Medicare Part A and B, and then the supplement is automatically taken. There are no networks unless you're on the old select plans, which are not around very much at all anymore. Number 6, annual plan changes. I kind of touched on that a little bit before, so I won't spend too much time there. People get on these Medicare Advantage plans and they think, okay, I'm just turned 65, I got on a Medicare, I picked an Advantage plan, I'm going to put it all in the file cabinet and it's all done. Not so fast on a Medicare Advantage plan. All the working parts that I've discussed Everyone is susceptible to those. Many, many moving parts behind the scene with Advantage. And it's crazy to me because I can't give you another example of an insurance policy that has that much working components behind the scene. It's not like that with Medigap. It's not like that with auto insurance, homeowners, dental, vision. There's just nothing like it. Okay, so just be advised. And number 7 on the list, as I mentioned previously, is that all Medicare Advantage plans are 12-month contracts. Really, what you're dealing with is a temporary 12-month policy with a Medicare Advantage plan, because they go annual election period to annual election period. Some people get on a plan and experience very little change year over year over year. But you are still in that system and in that process for change. So you do need to make sure you review. You do need to make sure your doctors are still in the network, that your prescriptions are still covered, that your copays are still affordable, that your premium is still in range. Here's my piece of advice to you is this. If you are looking at the difference between a Medicare Advantage and a supplement, I hope that I gave you some behind the scenes knowledge of what to expect. In our office, when someone calls and says, I'm new to Medicare, I need help finding a plan, 99% of people are very confused and don't know what they want. But what they're seeing is massive marketing and advertisement around the Medicare Advantage plans. Very little advertising around Medigap, and that's because Medigap is not as profitable as Medicare Advantage to the insurance companies. The commission that they pay to an agent is far less on a Medigap plan than on a Medicare Advantage plan. Okay, so a good agent should ask you questions. In our office, we have fact finding, so we want to know how often you go to the doctor. Why does that matter? Because if you go a lot and you have chronic conditions, the copays are going to add up on a Medicare Advantage plan. We want to know, are you okay with referrals? Do you need to travel? Are you okay if you can only get care in your region or your county? How many prescriptions do you take? When I tell you about an Advantage plan benefit and then I tell you about a Medicare Supplement or Medigap, which one do you prefer? This industry is heavily biased to Medicare Advantage, and it's just flat out wrong. A member or a Medicare beneficiary deserves to know the avenues, both avenues that they have with both plans, and so that they can decide. They should not be shoved into these Advantage plans or lured in with free stuff, or not be advised on the negotiations between Medicare and the companies and the provider disputes, everything I've talked about. Every agent should tell you everything I've told you in this video at time of product presentation. That's just the bottom line. You should be a brainiac smart in a simple way when you're done with the call on your 2 avenues. If you have questions, comment below, call us, email us, reach out. We'd be happy to help in any way. I hope this video helps you make a better decision on your Medicare journey. Thank you.